All right. So, hi everyone. I hope you can hear me. Again, sorry about the technical difficulties. Anyway, we'll get stuck into it. I think we've got about, I'm just checking the time. So we've got about 50 minutes. So I might just try to go for half an hour or 40 minutes and then leave plenty of time for questions and discussion. So I really want to focus on really quite practical ways of trying to, get some good partnerships and evaluation between researchers and community-based providers. So I'm not going to talk too much about and excuse me if I'm break down with coughing and I'm just getting over a bit of a cold, so sorry about that. But I really kind of want to focus on the practicalities rather than the sort of rationale for why we should be doing this sort of stuff. But when I give this talk in an academic forum, we show some results of literature reviews we've done where we show that, there's really an underrepresentation of good evaluations in Aboriginal health. So I'm not going to go through that today, but we're just taking it as read that we really, in my view anyway, need to get much better at doing good quality evaluations. And this is, I'll just go through some of the principles of how we're trying to do it with my team here. And give you a couple of practical examples. So these are the principles. So some of this, I hope, will sound fairly straightforward. And I don't think that conceptually this is all that difficult. The problem is how to do it in practice, and that's really been, why it's difficult. And partly it's difficult for, evaluation reasons, and we'll talk about some of that in a minute. But partly it's difficult, I think, for the sort of practical problems of how you actually roll out a program. So the first one is being really clear about defining the program, so or defining the problem that you're trying to address. The next one is defining the program, and again that sounds straightforward, but we'll talk about it some more in a minute. So defining what the program actually is and why you think it should work. So what we're trying to do is get really good alignment between understanding what the problem is and what the action is that we're going to put in place or the program we're going to put in place to try to impact on that problem. The third one is something that's probably a bit of a academic boffin thing, but I would always do a literature search before I start in a program just to make sure we're not reinventing the wheel. If other people done it before, that sort of thing. Then getting into defining how you're going to evaluate your program, what measures you're going to use, those sorts of things. And it's really important wherever possible to do that up front. So even if a program's been going for a while, if you get to a point where it's being redesigned, then that's a good point to sit down and think, right, how can we actually evaluate what we're doing here? The next one then is making sure the program's sustainable. Really, a lot of what we try to do with community-wide programs is liaise and partner with service providers to get them to kind of integrate new ways of doing things into what they're already doing. So we're not trying to get people to do more and more work. What we're trying to do is say, so these are the things we're trying to achieve. What if you did these activities rather than those activities, for these reasons? So it's sort of trying to, the sustainability one's really important, but it's trying to get service providers to think about how they deliver this. So it's not a question of delivering services or not, but it's how can you deliver a service in a way that's most likely to be effective and sustained. And then the last one's partnering with sort of multiple services. So one of the all communities order. So if, let's say, you're running a community-based program in, I don't know, Broken Hill or somewhere, if you just do it in Broken Hill, you don't do it anywhere else, you're never kind of going to have enough ability to say that, even if you can show an effect from your program, when you're just doing it with one service or one community, it's really hard to be sure that it's what you're doing that's having the effect and not something else. So the way around that is to try to partner with other, services in other communities or other whole communities and say, well, let's see if we can work together and come up with a program that we can test in all of our communities. And once you do that, then you're getting much better sort of quality evidence. So all of that we'll go through now in terms of some examples. So, excuse me, these are just some of the sort of problems I think we've learnt, or some of the principles that we learnt in what we've done so far. And so these seem to me to be, this is just a grab bag of ideas that seem to me to be things that have consistently come up across multiple communities and programs. So one is being really clear about who's doing what. So like when we partner with programs, I'm really clear that I don't know how to run a program. I'm not a clinician. You know, what I know is how to do evaluation research. So what we need to do is find ways to sort of bring together the skills I've got as a researcher with the skills that all of you've got in terms of delivering programs. So I don't know what they are, and the trick is to, you know, find ways to bring them together, but being really clear about that. So it's not researchers coming to tell people what to do. It's trying to find, you know, the way we typically do it is to say to program managers, well, tell us what you do, and we'll go away and try and write that up in a sort of researchy, academic way, and we'll bring it back to you and get you to say, no, that's not right, that's not quite right. And in that sort of backwards and forwards process is where we get, you know, a good definition of a program. So one is being, that first one's really important. The second one's being really clear about the outcomes you're trying to achieve and how they're going to be measured. And that, the reason that's really important is because you come up with all sorts of ideas and strategies and things you think might work. And it's, you know, I think to avoid sort of wasting resources, it's really important to think clearly as you can at the start about, if we do activity A, is it really going to impact on this problem, and how we measure that. So trying to be really clear about that, and I'll give you an example about of a sort of what we call a program logic that will help you think about how you might be able to do that. The second one is designing, and you know, it's good interventions. I'm not sure what I mean by that, but they're things like making sure there's clear alignment between the activities or the program and what the outcomes are. We've talked about the literature review ideas. Making sure there's a good relationship between the people doing the evaluation and the people delivering the program, so that ideas flow both ways. So it's, you know, I think to get the best outcomes, we need both. So it's really important to make sure that's that there's a process for that. We'll talk a lot in a few minutes now about this idea of standardizing interventions and making them flexible, making it sort of practical and sustainable. And I think the last one's also really important, the last bullet point there. So kind of recognizing that, as I'm sure you all would be much more aware than I am, but you know, in the day-to-day delivery of services, you're always, you know, tweaking things, trying to make them better, changing what you do. So, you know, there's no good having researchers come in and go, well, everyone has to do exactly the same thing at exactly the same time, because it's just not going to work. So trying to find ways of, or it's important really for researchers to understand that sort of, that program deliveries are a really dynamic thing, and we need to find a way to integrate that into the evaluation. And the last one, again, it's a bit researchy, but I think we've really struggled to do good evaluations over the years because, you know, researchers have tended to say, well, we only get really good evidence if we do randomised control trials. So, but if you're doing that in public health, so you've got a program that goes across a whole community, then you really need 20 or 30 communities to do a randomised control trial. So that gets really difficult. We've done it once, which was that trial that Avina talked about at the start, but it, you know, it cost $2 million or something and took us 10 years. Like, it was really hard. And you know, I'd argue that using that randomised control design, so the best design you can do in research, means that work is methodologically, you know, really watertight. So it's a really nice piece of research, but in practice it hasn't done much. So everyone kind of moves on and says, you know, well, we were doing this 10 years ago, we've all moved on. So in actual fact, doing that project really prompted me to think, how can we do this better? So maybe we don't need to drown the cat in cream. So maybe we don't always need to do the best possible sort of evaluation design. But equally, we can't just do, you know, one service doing one thing, because that's just pre-post, and that's not good enough either, I think. So it's trying to find evaluation designs that are somewhere between that one service or one community pre and post and a full randomised control trial. And as I got there, I kind of think about that as being designs that are rigorous, but they're sort of good enough. They're not the best, but they're good enough. Right, here we go. So here's two examples. The first one's a program called BackTrack, and this is for high-risk young people that had been implemented in those communities you can see there, Armadale, Tenterfield, Glen Innes. Alice Knight's been working on this. She's based here at NDARC, the National Drug and Alcohol Research Centre. She's a PhD student, so she's been taking the running on this, and I always feel like I'm going to get into trouble with ICAC or something if I don't point out that I got involved with BackTrack because my brother manages it. So, and it's having a family argument at Christmas once, and I kept saying to him, well, if you think the program's so good, why don't you evaluate it? And he'd say, well, isn't that your job? Why don't you come and evaluate it? So we eventually got our heads together and got some money to do this evaluation. So when we first started to talk to BackTrack, the staff there, we'd say, well, what do you want us to do? And they'd say, well, we know the program works. We just want to show, prove it. So that was the starting point. And I think that's fairly typical. So we need to go from unpacking, when we say a program works, we need to be really clear about what that means. So what is the program? And when you say it works in achieving what? So what sort of outcomes? So, so I was mentioning before, one of the things that I'm a bit obsessed with is doing literature reviews. So we did one around for programs that are like BackTrack. We found no one had done an economic evaluation. There were very few evaluations. I think there was something like 11, no, even less than that, 3 or 4, something like that have been published, in the last 15 years. So very little good quality data on whether these programs actually work. So I'll talk about the definition of BackTrack in a moment. But these are the ways we evaluated it. So we had a series of outcome measures that were self-report. So and we tried to build these into the routine practice of BackTrack. So, when the kids came in, BackTrack were already collecting a bit of basic information, age, sex, are you at school, that sort of stuff. So what we wanted to do, so what we did was work with them to try to beef that up a little bit. So we know it's, the practicality is that kids aren't going to sit there and answer 50 questions over an hour. So we had to balance, us wanting information on everything with that practical components. But we got to a point of asking, there's about 20 or 30 questions we ask around their mental health, their drug and alcohol use, their empowerment, their levels of empowerment, quality of life, things like that. So we got that, as I say, into about 20 or 30 questions. We're also looking at routinely collected data. So we're measuring it, looking at rates of crime amongst young people across the whole communities. And the reason that should work is, when we're talking to them, they used to say a lot, things like, well, these kids are really hard, and these, they're a small number of kids, there's 20 of them or so, but they're the ones that commit all the crime. So if that's true, then if you do something effective with those young people, then you should be able to see a reduction in crime across the whole community. So that's what we looked at. We did some interviews with staff and with some of the kids. Observation is one we haven't done a lot of yet, but I think it's got great potential. So there's things like when the young people first come into the program, they kind of all sit around with their hoodies up and won't look at anyone. But after a month, they'll come and shake your hand and look you in the eye and all that sort of stuff. So I think they're really, really important outcomes, and we just haven't come up with a good way to measure them yet. We're doing a full economic analysis, so we'll be able to show whether the costs of delivering the program are outweighed by the benefits of the program. And then in the next column there, you can see there's a whole series of process measures. So things like how many kids got all the intervention components, was the intervention delivered as it should have been? So, it's one thing to say, here's the intervention, but then we need to be sure that that is actually delivered in the way it should be. And then things like staff and clients' satisfaction and acceptability. So are they happy enough with the program? So they're all the sorts of measures we came up with. And this is our, you might remember a couple of slides ago I was talking about or briefly mentioned the idea of defining interventions or programs in a way that's standardised but allows for them to be flexible across different communities. The reason that's important is because you get, we've got this tension between, researchers want all programs to be exactly the same because that way we can say, well, we're testing a very specific program, i.e. it's got, components A, B, and C, and that's it. But when you talk to communities and service providers, they rightly say, well, those things might be all right in one community, but they're not necessarily going to work in other communities. And that could be because the clients are slightly different. It could be just that there's different resources. So one community might have lots of resources from the local council or whatever, so they can do, lots of things. Other communities might not have that. And then even things as simple as the real key interests of the staff. And I think they're important things to take into account. So we've kind of got this tension between wanting everything to be standardised versus the reality of knowing that things need to be flexible. So the way you implement something, a program in one community is going to be different to another. So the way we've tried to resolve that tension is by having these core components. So in the case of BackTrack, the core components are effective engagement processes, good skills training, case management, and personal development. So the logic is to say, as long as a program has got those 4 components, then we can say that it's the same program being implemented in different communities. And then the way that we allow for the flexibility is to say the actual sort of activities that give effect to each of those core components will be different in each community. So the effective engagement processes in one community the actual activities might be very different, in one community compared to another. So BackTrack, for example, does a lot of work with, working dogs. So they go to ag shows and all that sort of stuff around the traps. So they use the dogs as an engagement thing. The kids come in, and the first couple of days, all they do is they get given responsibility for a dog, and they've got to make sure it's fed, make sure it's locked up at night, got water, all that sort of stuff. So that's their way of getting kids engaged in the program, talking to the other kids, and just feeling a bit more relaxed. But you could do anything. You could use music, you could use art, whatever you like. So sport. So the argument is that it's not the specific activity that's important, but it is important to have an effective engagement process. And then that's the same for the skills training. So it's really important that the kids get some, or the young people get, some, because most of them have dropped out of school, so they've got to get some access to skills training. But what that looks like and how that works will be different in every community, and then the same for the others. So here's what it looks like. This is the program logic, and here's what it looks like when we try and put it together. So in the first column, A is the area of need. So you can see that there's the area of need, or the problem we're trying to deal with, is young people with multiple and complex needs. And those risk factors, or those multiple needs, are things like low or no school attendance, using substances, not always, but often low levels of resilience. They're kind of got a lot of psychological stress in their lives, violence, very, things very unstable in their lives. They tend not to have very good coping strategies, mental education, all the things you can see there. So the next thing is defining the intervention. So in the first bit of that column, you can see on the left-hand side the core components. This is not very big, so I hope everyone can actually read it. So the core components are, as we talked about in the last slide, engagement, learning and skills, personal development, identity, and case management. And then these are some examples of the flexible activities that sort of give effect to those core components. So the dog handling is the example I talked about as the engagement strategy for BackTrack. BackTrack they've got an agreement with the school where some of the teachers will come down and do, I think they do about 2 hours a day at school, and that's it, of schoolwork. And then other things you can see there. So I know I've been over this a few times, but the idea here is, the concept I'm trying to get across is that any community should be able to run a program like this for high-risk young people, and we can say it's the same as BackTrack as long as it's got those 4 things. That might have other core components. So an obvious one in Aboriginal health is, a much greater cultural component. So a 5th core component for lots of Aboriginal programs will be a specific cultural component. So that's absolutely fine. And then thinking about what the activities might be that would give effect to that cultural component. So the mechanism of change, this is a tricky one, but the reason that we think those core components should work are these things here. So one is that the kids successfully engage with the program, so that relates to the engagement component. That they have reduced exposure to high-risk situations, so that's trying to give them things to do, you know, on weekends and evenings when otherwise they'd be getting into trouble. So you're reducing the opportunity for them to get into strife. Improving their personal skills, so you can't always, you know, avoid high-risk situations. So the improved personal skills is trying to give kids a greater range of strategies that they can draw on when they're in risky situations. And then the last one is improved learning and life skills. So, you know, really that's to increase their opportunity to get involved in employment and their communities. So that's why each of those components, the mechanism by which they should work, and then measuring the outcomes there, that's pretty straightforward, I think. Right, sorry, I feel like I'm rushing through this, but I hope that's kind of making some sense. Right, so this is an evaluation. Remember I was talking about, you know, at the one extreme we've got randomized control trials that are the kind of holy grail for researchers. At the other end, you know, there's case studies or one community or one service pre-post. So this is an example of something in between that we applied to BackTrack. So if you just look at community 3 down the bottom, if we only evaluated BackTrack in one community, let's say Armidale, and that was community 3, if you just ignore the others for a moment, so you can see the baseline period there. So say the outcome is, well, in this case it's crime, so young people involved in crime in Armidale. And this is the rates of with which young people were involved in crime in Armidale before BackTrack started. And then the blue vertical line would be when BackTrack started, and then the green dotted line again is rates of alcohol-related crime amongst young people after BackTrack. So what we're trying to do is say afterwards there's a sort of reduction, a kind of gently decreasing proportion of young people involved in crime after BackTrack commenced relative to what it was like before that. So if you did that, you'd say, oh, well, that's great. That clearly shows that BackTrack had an effect in, you know, slowly reducing the involvement of young people in crime. But the problem is, how could we be sure that observed trend is actually due to BackTrack and not something else? So how do we know at exactly the same time BackTrack started that, I don't know, there wasn't a new police commander who came in and said, look, unless you have to, we don't want you to record crimes amongst young people anymore. So, because that could also explain why there'd be a reduction. So that's the problem. If we just done it in Armidale, you end up with this problem of not being entirely sure that it's the program that you've done that has the effect and not something else. So the way we get around that, or the way we're working on to try to go around that, is to implement exactly the same program in a different community at a different point in time. And so that would be community 2, the one above it. So the logic says we're using the same outcome, i.e. rates of alcohol-related crime amongst young people in 2 different towns. So we're using the same outcome. We've got the same program that's standardised by these 4 bits, even though the activities are slightly different. So we've got the same outcome, the same program, but we implement it at different points in time. And if you have the same effect, then you're starting to get good evidence that it's the intervention that you're putting in place that's having the effect and not something else. And so you can do that 3 times or 4 times. So the real advantage of a design like this is it gets away from just using one community or one service, but it doesn't require 20 or 30 like you would in a randomized control trial. Okay, I promise that's the last sort of technical boffin academic stuff I'll bore you with. But that's the reason I wanted to show you that slide is because that's the reason, you know, earlier on I'll sort of say it's really good for services to think about partnering, or communities to think about partnering with each other rather than just doing things by themselves, because it gives us much better evidence about whether the program is effective or not. Okay, the second one is a whole of community approach to reducing alcohol harm. So this was working with those 4 communities, but specifically just with the Aboriginal communities within those communities. So Griffith, Narrandera, Lake Gelago, Murrum Bridge. So these are kind of all southwest New South Wales. It was funded by New South Wales Health. And what we did was sit down so it was led really by the AMSs in each of those communities, and we sat down with them and said, right, we've got this funding, the money's yours, you need to decide, you know, like I was talking about before, we can help do the evaluation, but we don't know what's going to work here. So you need to decide what you want to spend the funds on, and then we'll evaluate it. So that was the sort of arrangement. And these are the sorts of principles we talked about. So one was having multiple intervention components, so not just doing one thing. The idea, we've talked about this already, so this is the idea of the core components standardised across the communities, even though the activities would be different. The communities needed to come up with what they were going to do and implement them in their own communities, trying to pick off the kind of low-hanging fruit, so that we did an analysis of data on alcohol harms for each community. So crimes amongst males, alcohol-related crimes amongst males in their 20s seem to be and on weekends. So that's the big problem. So you really want activities that are going to target those things. That's second point is that's the idea of the males in their 20s, which was sort of common across all of the communities. And then the last one we've talked a lot about as well. So that's how do we didn't want to do activities that were purely funded by the project, so the project stops, it all just falls over. So what we wanted to do was say, if you want to implement an activity, who in the community can do it as part of their existing role? So we might put some money into training, retraining, and that sort of stuff, but it's got to be someone's job to be able to do it, rather than just do it for a short period of time. Okay, so these are the 3. So for this whole community project, they came up with 3 core components. So one was improved service engagement, or case coordination was the shorthand. So that was trying to say, how do we get more clients engaged into existing services? Second one was improved empowerment. So they really wanted to do something about how do we empower Aboriginal people to take more control over their lives. And there just happened to be a program that we knew a little bit about called Family Wellbeing. So we used, we suggested to the communities that could be something they could invest in. So they kind of looked at it, they really liked it. So we got, the Aboriginal health workers in the AMS and some people working for NGOs like Centacare and Mission Australia. So they're all Aboriginal workers, but we got them trained up in how to deliver family wellbeing, and then they could deliver it, and still do, as part of their ongoing roles, just part of their job. And then the last one was community activities. So that's really just finding opportunities for communities to come together and do things, without necessarily drinking. So this is, so Maldahnalanga was the name of the project, which it's a Wiradjuri word that means coming together. So the core components, you can see the 3 of them in the first column there. So improved service engagement, community activities, and improved empowerment. And then you can see we combined Lake Gelago and Murrum Bridge because they're really close to each other. And this is just to give you a sense of some of the different activities that happen in different communities. So in terms of improved community activities, Griffith, for example, did midnight basketball. Lake Gelago and Murrum Bridge did touch football and movie nights, and Narrandera did things like indoor soccer and an outdoor movie night. So you can see that there's some overlap with activities, but essentially they all come up with their own ones. They all did family wellbeing, so that was consistent across all of the communities, and they all had slightly different ways of doing case coordination. Some of them employed engagement officers to sort of actively work with high-risk families and individuals to get them, more engaged in services. So I think what I'm trying to do is demonstrate that whether you're working with an individual program like BackTrack or working across a whole community, same principles can apply. What are the core components and what are the activities that give effect to those? So we had a whole range of outcomes, things like community surveys, people who participated in a program. So you wouldn't ordinarily do a survey except with them if you're just delivering a routine service, but we did it because it's part of we're trying to evaluate whether or not it's effective. The process of things like the community's perceptions have changed. So did they feel like at the end of the project they were able to generate change if they wanted to? And then again, we're doing a thorough economic analysis. So here's our program logic for the Maldahnalanga project. So the area of need is alcohol-related harms, including things like injury and violence. So that's one thing we want to improve. And the second thing we wanted to improve was the sense that the community had that they could actually make changes they wanted. So that sense of empowerment. So the core program components and the activities is the next column. So improved service engagement, community activities, improved empowerment. The mechanisms of change, really similar to BackTrack. So the first one is trying to increase the engagement with services so more people can benefit from getting access to services. The community activities is about reducing people's exposure to high-risk situations. And then the third one is, again, improving the sense with which people feel like they can make changes in their own lives. And then the outcomes we've talked a lot about. Right, I think we're almost there. So this is really a slide just to give a sense of what I think if we're going to do this kind of more getting better at integrating researchers and service providers, what might that mean? So I think these are, again, just some ideas that have occurred to me. So it's really important, as I've been saying, that I think both researchers and practitioners have input. So there has to be benefits for the people delivering a program. There's got to be benefits for researchers. Otherwise, it's not going to happen, I think. So some of the benefits for service providers is that they can get greater control over the process of service delivery. It creates opportunities for some of their staff to do training, even in academic training. So, I think it'd be fantastic if we could get more Aboriginal people doing PhDs and just learning the process of how to do good quality evaluation. In fact, Kate Conograve and Scott Wilson and Noel Heyman and myself and a few others have just got a National Health and Medical Research grant called the Centre of Research Excellence to try to improve the use of or the capacity for Indigenous people to do good quality evaluation research in the area of alcohol harm. So, I'd be really keen to hear from people who might be working in the alcohol area that would be keen to be involved in that. Increasing the relevance of research. So, one of the problems of academia is I sit in my office and do my own little thing and dream up these things, that are interesting and, you can do nice evaluations. But if it doesn't make any difference in the real world, then, it's kind of becomes questionable about why we're doing it. And, I think there is an argument for learning, just generating knowledge for the sake of it, but perhaps not in public health and in areas, where there's a real need, like the need to close the gap between Aboriginal and non-Aboriginal health. Researcher benefits, as I say, things like being more engaged in real-world programs. And actually, we should be able to get better at more publications and make, so what drives me when I sit down with my boss every year for my annual review, he says, how many grants you got and how many papers you got. So engaging better with services should enable me to do more of those things. Another implication is that, researchers and neither researchers nor service providers can probably just do whatever they want to do. But, there's got to be coming together and compromising and working through, how we can do things that benefit both of us. For communities and clinicians, I think one of the real challenges is, they're all flat out trying to do, work with often time-consuming clients with multiple problems, multiple issues. So, that it's not easy. But to try and, on top of that, to trying to get service providers to think, about doing things differently is quite difficult. So that's another problem. we know in research that there's this gap between what we've already kind of demonstrated with evidence and what actually happens in practice. That's absolutely not specific to Indigenous health. That's true across the board. So I think better partnerships will reduce that gap. So if we can be generating evidence at the same time with delivering services, that gap will disappear. Making better use of data that's already collected. So, people who provide services collect all sorts of data on people as they come into programs, and we just don't use it very well. So these partnerships are an opportunity to make better use of those data. And I think, getting back to that idea of you're never going to get the perfect answer to whether or not a program works, but it's saying, doing a program this way gives a better outcome than what we used to do. And then it's a constant process of, we'll tweak it again. Is it better? Yes or no? Tweak it again. Is it better? Yes or no? So I think if we can getting away from the idea that we're going to come up with a perfect program and that'll be it forever and a day, to thinking, how do we constantly kind of keep reinventing is not quite right, but keep modifying what we're doing to make it more relevant for clients, to improve the outcomes, etc. And I think that's it. Right. So over for questions.
Thanks so much for that, Anthony. Yeah, so if you guys have any questions, just type them in the chat box and we will forward them on to Anthony so he can answer for you.
Okay. No question?
No one's got any questions? Anything pressing that you'd like to ask Anthony?
I must have put everyone to sleep.
No.
I'm sure that's not the case.
So if you have a question, here we go. Got some Jason typing.
Hey Anthony, if you want to just press stop sharing, there should be a button that says stop sharing. We'll be able to put up your contact details in case anyone has anything they'd like to ask later on.
Okay. Stop sharing. Do you know where it'll be?
Should be maybe up the top or in the middle of the page.
Okay. Janelle Dufty from Murrumbidgee PHN has asked Anthony, will it be possible to get a copy of the slide?
Yes, of course. If I email them to you, Ivina, can you make them available?
Absolutely, yeah.
Yes,
I just think, yeah, we can give everybody, we popped some contact details up. So if you'd like to email me, Ivina, at a.trzynski@ecu.edu.au, we'll be happy to forward those on for you. Excellent, thanks Janelle.
Okay, so we've got another question from Christine Hendricks for you, Anthony. She said, one of my challenges is encouraging our stakeholders to respond to our data collection surveys. Any advice how to encourage better engagement?
It's a bit hard to, I'm worried I'm going to sort of be telling you how to suck eggs here, so I'm sorry if I do. Is it possible, one thing that I find works quite well is getting people involved really early on. So if there's a way of perhaps redesigning your data collection survey, but get the key stakeholders involved right at that point. So, invite them to come along to a workshop or something and say, look, we've been collecting this data like this for the last 2, 3, 4, 5 years. We think it's time to change it. So tell us what what would you like to see in here and why, what would be helpful for you? What do you think is useful? And just let them tell you everything and just sort of take it in and then take it away and try to get it into some sort of format, make sense of it and, go back to them. So I don't know if that's very helpful, but getting end users involved in redesigning things like server at the start is really, I think that's really gives them, skin in the game, as people say these days. I think that's really important. And also, you'll come up with, you'll be amazed at what you find when you've got those people who are, really engaged with delivering services or whatever their role is. You'll be amazed at some of the really clever ideas and concepts that they come up with.
Awesome. Thanks, Anthony. That was a good answer. Cheers. Any other questions from anyone? So another one from Jason Jin. He said, it's not uncommon that the routine data collected are quite different from data collected through research instruments. Do you have any comments?
Yes, that's true. So I think it's trying to, and you want a range of measures and a range of outcomes. And so I think you sort of actively want to avoid replicating, by and large, want to avoid collecting the same data. So I just think about them as collecting two different things. So if you take the BackTrack example, I'd say if we're using the sort of routine data collection, so that's the incidents that police write down as being, crime incidents involving young people. What that's measuring is the extent to which there's sort of interaction between police and young people, albeit in a way that's not very helpful. So that's measuring that, but then there's all sorts of things you can measure using self-report directly from the kids that's really different to that. So it's things like, how comfortable do they feel in their community? Do they feel threatened by the police? And then questions specifically about the program. So I think it's just trying to line up a suite of measures that are complementary to each other rather than kind of just replicating each other.
Thanks, Anthony. So we just have another question as well from Michelle Roberts.
Yep.
She said, as part of our commissioning process, we are keen to include evaluation as part of the deliverables. Do you have ideas around when it's a good time to do the evaluation for the new services?
Yeah, so that's a very good question. One of the difficulties is, well, I think, so this is the world according to me, but I think one of the difficulties is asking services sort of by themselves or independently of anything else to do evaluations of their own programs. It's really hard because they're flat out trying to deliver services. They've usually got a lot on, so it's pretty hard for them to also do evaluation. So I think one of the things I would do is see if you can get a little evaluation team within the department, and think about some of the so when you're asking services, when you're going to fund services, think about whether there's a way of saying, using that core components and individual activities. So rather than giving them, say, the funding of the services, you could say, here's, there's no problem about giving you funding, we're going to do that, but could is it possible for services to define what they're going to deliver in this way? So what are the core things that you're all going to do and what are the specific activities? And then you might talk to them about collecting a core set of common data. So if you could come up, as I say, with 10 or 15 or 20 questions that they could all collect, and it might be things around, just the psychological distress of their clients, substance use, resilience, quality of life, whatever, just a handful of things. And then, of course, services can ask anything else they want to, but if you can get them to deliver a core set of things and collect a core bit of information, that, I reckon, that really puts you gets you in the way then, or in the process of doing really good evaluation. And I'd be happy to talk to you more about that, because if you're in the process of just sort of renegotiating funding tied to the delivery of services, and that's a really good time to start a conversation about, it's not oversight, so it's not sort of trying to say you have to do it this way and we're going to be watching you. It's trying to say, we'll be able to all benefit. We'll get much better outcomes for clients, and over time we'll really be able to benefit if we can all get a bit of consistency over what we're delivering, even though each service has to work out, as I've been talking about, the individual things that they need to deliver themselves. But it's a really good opportunity, and know us more about that if it's helpful.
Awesome. Thanks. Okay, so we've got another question from the NWHSA TODs, and they've asked, what are some valid and reliable measuring tools or evaluation tools when evaluating programs for Indigenous people, i.e. targeting alcohol-related harms? So I think they're talking specifically about Indigenous tools.
Yeah, so there's a few, not as many as we would hope, but there are some. So there's something called the audit questionnaire. That's AUDIT, stands for Alcohol Use Identification Disorders Test. And it's the full scale is 10 items, but there's a shorter one. The first 3 items is called the Audit C. And we've done some work looking at getting scores that are specific to Aboriginal people. So so that's one, the Audit C, using the Aboriginal cutoff. And if you Google Bianca Calabria and my name, that paper should come up where we've generated Aboriginal specific scores for that. The IRIS is another one that you might be aware of. So that is more a measure of alcohol dependence. What else is there? Kate Conograve at Sydney University and Scott Wilson in South Australia, they've just developed a like an iPad questionnaire that people can fill in, that helps, rather than just sort of say, how many drinks do you have, how often do you drink, and how many drinks do you have. It's kind of more visual and allows people to kind of better estimate how much they drink. So if you emailed Scott Wilson in South, I've just forgotten the group that he's with. Sorry about that, but he's in South Australia, or Kate Conograve at RPA, and just ask him about the iPad that they've developed. I'm sure they'd be very happy to because on there is a whole series of questions about alcohol harm, so that would be a really good one to see. It'd be really interesting to see what they've included there. Actually, again, if you send me an email and you want me, I could have a look around and come up, have a better look at what some of the Aboriginal specific alcohol questions are. But the audit and the IRIS, I know they've definitely got Aboriginal specific cutoffs.
That's great, Anthony. And I think we do have one more question, but just on this last one, also to the Knowledge Centre website, they want to have a look in health practice resources. We have a lot of the specific Aboriginal and Torres Strait Islander tools and health promotion, health practice resources as well. So I would encourage you to look at our website. We've also just popped up Scott's email, and I might be able to find Kate's email as well to put through for everyone if they need to follow up with those recommendations, Anthony.
Yeah, great.
Another question from Viv. Just following up on the question and response that we might not have multiple services that deliver similar programs. What's the best way to evaluate programs that are standalone or not easily affordable or replicable?
Yeah, so in that case, you really stuck with pre-post. So, there's it sounds like some of the programs you're dealing with are really quite unique, and that happens. That's what in the real world, that's what happens. So, I think the only way you can do that is a pre-post. But you can still work with a service like that to say, well, what information are you collecting as people come into the program? Can you collect it, say, 3, 6, and 12 months after they've been in the program? Partly that gives you good data on whether people are improving as a result of being enrolled in the program, but also you can then feed that back to clients. So, if they're feeling questions, let's say on their psychological distress, using the Kessler 5 or some tool like that, and then, if you can show them that 3 months later they've improved, that things have got better for them, and here's one way of looking at it, then, that's a really powerful part of a program as well. So I think you can still try to get the services to answer or to use good evidence-based, measures across a range of different domains, as I say, substance use, mental health, quality of life, whatever. and then recollect it periodically. So, you know, whatever, 3, 6, 12 months, whatever it might be, and then try to find a way to feed that back into the community. So even if we could just get that, getting all programs to collect agreed information, feed it back to the clients, and then, you know, every 6 or 12 months or whatever, that'd be fantastic. And actually that, you know, in the absence of being able to do a better evaluation than that, that's absolutely even publishable. You know, there's no reason then you couldn't put that somewhere in the peer review literature and say, look, here's what we're doing in this area. It's a really unique program, so we're just doing it as a pre-post. Here's the outcomes. And that's really important because then other people read it and go, oh, actually, we could do that as well. So I'd really sort of encourage you to think about trying to do that.
Excellent. Thanks so much, Anthony. So I think we should probably wrap it up there as we've just gone over time. But if you've got any further questions, we do have Anthony's contact details on the slide there, and also the contact details for Ravina and myself. So if you'd like to provide any feedback or you have any further questions, just please get in touch. So I think that's it for today. Thank you so much for coming and presenting to us, Anthony. That was really great. And just like to let you know as well that we do have another webinar coming up in March, and this one will be guest presented by someone from the National Centre for Education and Training on Addictions. So stay tuned on the Knowledge Centre website for further details about that. Cool.
So thanks everyone for listening, and we hope you had a really great time listening to Anthony. I really enjoyed that presentation. Thanks, Anthony.
Okay, no worries.
We'll see you soon.
Thanks,
See you later. Okay, bye.
Bye.